Susan, thank you very much for that talk. Wonderfully informative, and this is a perfect audience to have a discussion about how we can raise awareness about these things. We just have a couple of minutes before we have to switch into our next session, but I wanted to open it up to anybody who either has a question or if you'd like to share an example from your own teaching or own learning process that could complement what Susan just taught us. Anybody? Well, then I'm going to offer one. Susan, I have like an obvious question. Are there any people in the world within the domain of what you're talking about who are working collaboratively to see if there is some way that we can bring together the differences that are coming across cultures?
So within and I'm going to talk specifically about psychology education at the undergraduate level, Dr. Jackie Craney in Australia at the University of New South Wales is doing really great work in this area, and she is cobbling together a team of people from different countries around the world to talk about how we might have some kind of a harmonization framework that's centered around psychological literacy and global citizenship. And I'm starting to weasel my way into that group because I think what they're doing is so, which is really, really cool and really inspiring. So I think there's hope, but I think it has to be, because we're so different around the world, it has to be something more like psychological literacy as a framework that can be adapted to different countries and cultures. There definitely is no, even within Bologna in Europe, there's no one size fits all.
So along that line, and I'm going to turn to something, Elisan put something in the chat earlier. Elisan, would you share with everybody what it takes to be a licensed psychologist in Brazil?
Yes, I was putting it in the chat because I think it's very different from many countries. Here in Brazil, it takes 5 years for the psychologist to get a license to be a clinical psychologist. And also we receive the clinical training in these 5 years. Many of the psychologists, most of them, opt to do 2 years of specialization in one approach to be able to feel better to practice. And for those who want to be teachers in the university, they then go to master's degree and then to it's 2 years of master's and 4 years of doctorate degree. And so I think this is very different from, at least from the United States.
So along that line, Susan, I'm thinking of the model for physicians because there are many physicians that I know of in the United States who were educated in other countries, and there is a format to become is there anything like that internationally for psychology?
So I think within the non-clinical world, if you have a PhD in psychology, you can come to the United States in many cases and be a professor, for example. But in terms of being a clinician, there are a number of different challenges there, not least of which is having the cultural and linguistic competency to work in a particular culture. But even if you do, it's very difficult across borders. And actually, I see Mary Bullock here, along with Mary and Melissa Morgan and Arpana Inman. We wrote a paper about USA psychologists working in international contexts, and we covered the different research policy, clinical and education, and sort of outlining the challenges that are faced. And that was just, from that perspective of USA psychologists working elsewhere. It's a very thorny problem, but I don't think that should stop us from working on it, because I think that any steps that we make can make it even a little bit easier to be able to do this. And we need to. I think the pandemic has shown us how interrelated we are. I'm preaching to the choir. The ICP folks are among the people who most embrace this. But I think any work we can do is going to be worthwhile.
That's wonderful. Since I just want to comment on, like, Susan, you may know that, part of our strategic plan is making ourselves an ideal resource. And it seems like the whole issue you're discussing is just absolutely central to what a service that ICP could provide. Great.
Absolutely. And I will likely bother several of you as I start working on this Jackie Craney project. So
Great. Love to have you be part of this.
Yeah.
Anybody else before we transition into our poster sessions? It doesn't look like it. So Susan, congratulations on your award. You're a very deserving winner, and thank you for a wonderful talk.
thank you. And I'm so honored and humbled to receive the award. Thank you.
And may I just say thank you, Susan, for a wonderful, wonderful talk. I also want to let everybody know that Dr. Machiko Fukuhara was with us, or she still is with us. And Naoki Azazuma also is. They're both from Japan. And it's bright and early, bright early. I think it's like 5 o'clock in the morning for them. And Dr. Fukuhara is a sponsor of the Fukuhara Award. So thank you. Thank you for being here, to both of you.